Hello, so now I'm going to talk a little bit about edema or swelling in pregnancy. So this can be swelling of the feet, which is very common, or swelling with the hands and feet. So if you get it in the hands, it's carpal tunnel. So this can be very sort of normal pregnancy symptom. I think most people are aware of it, but you do need to let your midwife know if you suddenly develop swelling, because it can also be a sign of preeclampsia, especially if it's in correlation with protein in the urine and a headache. So you do need to let your midwife know just so that they can rule that out. But most of the time it's just something that does just happen to people. So there was one day last summer when we had that really hot summer, and everybody in my clinic, every pregnant woman just came in and suddenly their feet had just gone whoosh, just sort of almost, just immediately that day. So it can be uncomfortable, especially if you have it in your hands. Carpal tunnel can be, difficult. Movements can be difficult. If you're starting to swell up in your hands, it's important that you take off your rings as soon as that starts to happen. It does respond well to acupuncture, so it's really a yang deficiency in acupuncture, so the fluids are not being metabolized properly in your system. So you can also take some self-help measures, like you can get splints that you can wear on your hands. You can do exercises like this in the mornings to try and get the fluid to drain. If you're getting it in your feet, really you need to get those feet up, and you need to rest as much as you possibly can, preferably lying on your left hand side, which will help the fluids to return. You can also get compression socks, so they are very uncomfortable in the heat, but if you're lucky enough that it's like autumn or winter, then basically you need to put those on before your feet touch the ground in the morning. So as soon as you wake up, have them on your bedside table and put them on immediately. As soon as you start to put your feet on the floor and walk around, gravity has taken effect, and it's going to be ineffective. You also need to massively increase your fluid intake, so drink 2 litres of water, because that will help to flush out the excess fluid that you're holding on to, and really think about reducing salt in your diet. So definitely no adding salt, so use herbs, spices to flavour your food, but also think about hidden salts. So I had one lady who was eating cheese and crackers, which she was enjoying as a little snack, but obviously that is very high in salt, and kind of pizza toppings, pepperoni, ham, any of those sort of things also contain high levels of salt. So you really just need to eliminate those from your diet as much as possible and up your fluid intake.